Okay.
I'm here today to talk to you about medical marijuana. Cannabis has been part of humanity's medicine chest for as long as history has been recorded. The first cannabis laws actually required farmers to grow it. If you go even farther back, in the 2700 BC, marijuana was used to treat gout, rheumatism, malaria, stress relief, pain relief, and also for religious purposes. Modern research suggests that cannabis is a valuable aid in the treatment of a wide range of clinical applications. These include pain relief, nausea, spasticity, glaucoma, and movement disorders. Marijuana is also a powerful appetite suppressant which can aid patients unable to eat. The Food and Drug Administration claims that marijuana has no currently accepted medical use in treatment in the U.S., but that is undermined by the ongoing supply of medical marijuana to 7 seriously ill patients under a federal government program. A privately funded study of these patients confirms that they have benefited from their use of medical marijuana. The Drug Enforcement Administration, the DEA, their chief administrative law judge, Francis L. Young, said in the matter of medical marijuana, in its natural form, it is one of the safest therapeutically active substances known to man. By any measure of rational analysis, marijuana can safely be used within a supervised routine of medical care. In fact, there has never been one single case of a fatality associated with marijuana, and it has been used by humans for over 10,000 years for both the medical and recreational and religious purposes. And Leslie Iverson, professor in the Department of Pharmacology at the University of Oxford, says, "I took an oath to do no harm. Doctors are willing to give you a prescription for a drug that is addictive and may kill you. They should also be able to choose a non-toxic drug like marijuana. Cannabis is a safer drug than aspirin and can be used long-term without serious side effects. But because of the amount of money made by pharmaceutical companies by the sales of narcotic medications, and the fact that they spend about $150 million per year lobbying our government, they do not support the legalization of medical marijuana. The FDA approval requires millions of dollars in research and testing, but drug companies conducting such research expect to recover their costs when the drug is sold. Drug companies will not invest in marijuana testing because they would not regain their expenses. Marijuana can be produced by patients or their caregivers at little to no cost, which is why the pharmaceutical companies don't support it. They can't make millions of dollars off of it. Properly grown medical marijuana is a natural medication, not synthetic. There is no organ damage, and if taken with a vaporizer or eaten, there is no lung damage. It helps with so many conditions that a lot of patients have been able to reduce the doses or eliminate the medications completely by using medical marijuana. But over 2.4 billion prescriptions are written in the U.S. every year at about $100 billion a year. Big business and corporate money keep legal drugs acceptable. The legality of a substance varies on who is proposing that it be legal or illegal. According to the American Cancer Society, cigarettes kill more people every year than alcohol, car accidents, suicide, AIDS, homicide, and illegal drugs combined, yet they remain legal. Currently, 16 states allow doctors to prescribe medical marijuana to patients, and many more have legislation in the works. Someday in the near future, we will all see marijuana legalized